Well, good afternoon. My name is Jared Lane Kildy. I'm the president of HonorHealth Foundation, and we're so glad that so many of you would join us today. We're excited to have all of you here to learn more about academic medicine and its promise for the future of healthcare right here in Arizona. It has been our privilege to work with so many donors who understand the critical importance of advancing medical education and research. To all our donors attending, you are an anchor and the alchemy of everything we do, the magic behind the curtain. I'd like to recognize Carter Emerson, chairman of the HonorHealth Foundation Board of Trustees, who's in attendance. Thank you for being here, Carter. There are also several HonorHealth board members and foundation board members and emeritus members attending, as well as hospital executives, staff, physicians, and nurses in attendance as well. We're so glad that all of you would take time out of your day to join us. I'd also like to extend a warm welcome to ASU faculty members who are attending. We're honored to have you as partners. Thank you for attending, and thank you for all of your support and your interest in advancing healthcare in the time that we are here on Earth. This is far more than just a virtual presentation today. You're going to hear from one of HonorHealth's most advanced thought leaders in academic medicine, Dr. Priya Radhakrishnan. She's our Chief Academic Officer and Vice Dean of Arizona State University School of Medicine and Advanced Medical Engineering. Dr. Radhakrishnan integrates critical care, education, and community needs with a strong focus on health equity. She also leads the HonorHealth Social Determinants of Health Collaborative and is a regent and former chair of the Board of Governors for the American College of Physicians. Dr. Radhakrishnan is a clinical professor who's also mentored countless learners and received multiple awards for innovation, education, and engagement with the work of philanthropy. As healthcare continues to evolve, HonorHealth is leading the way by integrating innovation and education and clinical excellence to shape the future of medicine. HonorHealth's commitment to innovation is powerfully amplified through its partnership with Arizona State University, the new American university and the #1 university for innovation in the United States. This dynamic collaboration brings together HonorHealth's forward-thinking healthcare approach and ASU's pioneering academic model, creating a win-win that drives transformational solutions. And indeed, Dr. Radhakrishnan is at the forefront of this transformation. Today, Dr. Radhakrishnan will share how HonorHealth is preparing the next generation of medical leaders through groundbreaking academic partnerships, research initiatives, and a commitment to personalized, compassionate care. Following her presentation, we will open it up for questions and comments. I'm going to ask that if you do have a question, that you use the chat feature in Zoom to submit your questions as they come up. We've set aside 15 whole minutes at the end of this presentation to answer as many of those questions as we can. Dr. Radhakrishnan, I know our guests are very eager to hear your insights and the vision of the future of healthcare. So without further ado, I'm going to turn it over to you.
Thank you so much, Jared, and good afternoon, everyone. Really appreciate the warm welcome, and also a huge shout out to Ashley and the foundation, HonorHealth Foundation, as well as my ASU and HonorHealth colleagues. This is really the story of a labor of love within the community. May I have the next slide, please? The next slide. And so, again, thanks for the attendees for spending some time with us to learn about this new collaboration. What I hope to accomplish today is really highlight how medicine is changing and why the intersection of engineering and medicine is so important within healthcare. And also, I'd like to highlight the partnership between ASU and HonorHealth in addressing some of the immediate as well as long-term workforce needs of Arizona. May I have the next slide, please? Many of you, I hope, most of you have heard about HonorHealth. We are a not-for-profit health system, but most importantly, our goal is to improve the health and well-being of those we serve. and to be the partner of choice as we transform health for our communities. And this partnership between Honor Health and ASU Health and ASU School of Medicine and Advanced Medical Engineering is an example of how we, by this partnership, really plan to accomplish this. We have been in healthcare since 1927, and you can see some of the stats here. I'm not going to read it all, but can I have the next slide, please? And historically, we started in 1927 as part of the Lincoln legacy. And you've seen the journey of Honor Health. Today, we have 9 acute care hospitals and really have a very large network of outpatient practices and many partnerships that really continue the focus on delivering exceptional healthcare. I think it's important to note that from a quality perspective, most of our hospitals have high scores from the rating agencies. And this is really personal to each and every community as well as member of the Honor Health team. And what we hope to accomplish with this partnership is really develop the leaders and the educators and the medical students and the doctors that'll serve us. Very selfishly, I'm very interested in this because as I'm getting older, I know that I need exceptional healthcare. And so the design is really intentional. For me, it's personal. May I have the next slide, please? Uh, why an academic partnership? I get asked this a lot. I've been at Honor Health. This is my 10th year. And, one of the best kept secrets is the long lasting legacy of medical education at Honor Health. Just to give you some numbers, we train over 900 medical students and residents, both from within Arizona, but also across the country. And the same for allied health professionals, a very strong legacy and history of training nursing and other allied health staff. We may have the next slide, please. We started with our family medicine residency program. For those of you that may not be very closely familiar with medical education, it starts with 4 years of medical school, and then you go into a residency program that may be anywhere between 3 to 5 years. And then some of our residents decide to subspecialize and then super specialize in different areas. Listed here are some of the residency and fellowship programs. Currently, we have 177 slots of graduate medical education, which means we have 177 residents and fellows at Honor Health. And this is really important because as we were growing our graduate medical education programs to really address some of the needs of Arizona, post-merger between the Scottsdale hospitals and the John C. Lincoln health systems, the then board really decided that we need to get more physicians here to address our healthcare needs. And we did this by starting a lot of residency programs. And during this journey, we realized that it was really important for us to have a very strong medical school partner. May I have the next slide, please? And I would be remiss if I did not showcase the Honor Health Research Institute, or HRI. We have several researchers and scientists at our research institute who partner and are primary investigators within for clinical trials. It's one of the areas where we have the first in human trials. Honor Health Research Institute is really famous for that. The other areas of healthcare research include health systems research and also innovation. And so, given the breadth of Honor Health in terms of medical education, both at the undergraduate, graduate, postgraduate level, and the research interests, this was something that the affiliation was something that we were ready for. Next slide, please. And along came the announcement that President Crow had mentioned, and Dr. Shireen Gabriel, who started the idea of the medical school. And really, ASU, as Jared had mentioned earlier, has always, for several years now, is recognized as the #1 innovation university here. And so the School of Medicine the goal of the School of Medicine is to blend medicine, engineering, technology while maintaining the humanistic qualities that are important for practicing physicians. And so our goal is to really leverage new tools such as AI, data science, and new tools that you and I may not even be familiar with. For those who are Trekkies, I really thought that the tricorder would be here already, but with AI and data science, we are pretty close. May I have the next slide? And a little about ASU Health. This partnership with the School of Medicine for HonorHealth goes beyond the School of Medicine. It's also with ASU Health. And we are exploring how our different areas of focus can really help build our community and address the community needs, especially within healthcare. May I have the next slide? So, I'm going to skip this and the next slide, please. And so, what do we hope to accomplish with this affiliation? It's really an opportunity for us to forge a transformative partnership between HonorHealth and SOMI and ASU Health that will redefine the future of medical education and healthcare delivery. And I'll explain to you what that means. It's a lot of words together, but healthcare today is really complex. And unfortunately, as research continues to grow, as we have new treatments, new trials, the degree of specialization that has developed has unfortunately not helped a lot with the patient needs. And so our goal is to really keep the needs of the patient and our community. Ultimately, through this collaboration, we will develop and train the next generation of physicians who will take care of me and you, who are really committed to improve the health of our community. May I have the next slide, please? And so how do we do this? We are within HonorHealth organized. Our clinical work is the majority of the work that we do. And really, our goal is to intersect the clinical work, taking care of patients, providing healthcare services with education, research, and innovation. And I'll give you a small example. The other day, I was in clinic and I had a young patient who came and he had what is called tachycardia, a rapid heartbeat. Most people would think that, oh, this is just an anxious young person. It turned out that, the reason he came to our clinic was the fact that he had multiple health problems. And this could have been easily dismissed as just a small issue with a rapid heart rate. But we had to take into account the complex medications that he was on, the procedures that he had had that impacted his heart. And through our process, we were able to get him the care that he needed, connected him with an electrophysiology doctor who is a doctor that deals with arrhythmias. And this was a patient who went from really being anxious about his care, being dismissed several times, that it was just an anxiety episode, to really getting the care that he needed. This is just one of 1,000 examples that a lot of my colleagues here can give you on a day-to-day basis. And our goal is really for our medical students, residents, and our healthcare team to look at opportunities such as this so that we can provide precision-based care, the care that is tailored to the patient at the right time. May I have the next slide? This is a question that many of us keep getting asked. Why a physician engineer? Is that the latest buzzword or the newest term? The reason, again, is complex. Several of you may have heard of the quadruple aim. With the complexity in healthcare today, we really do need to look at re-engineering our healthcare system as a whole and ultimately applying it to the patient. While I'm being a little facetious, you know that if the other day I was looking for a sofa, and the next thing I knew, every time I'd go online, I would get ads for sofas. I'm not suggesting that we do that with healthcare. However, if Google can figure out that I need a sofa and keeps bombarding me to my detriment, we really need to use this technology to improve our care and also reduce the burden for our healthcare teams. May I have the next slide, please? And to how do we do that? I always like to start at the beginning. Healthcare before the 1900s was very much an apprenticeship model. You would go and shadow a physician, and you would learn about the physical exam, how to diagnose. And as medical education sort of advanced, there was a realization starting in 1910. The landmark Flexner report came out, which really called out the importance of standardization and a science-based curriculum. And so, what we are doing to medical education today is really applying the principles of science in education and how can we improve education. And this led to the explosion of change that happened within medical education over the last decades. This expanded into graduate medical education, which is residency and fellowship programs. And from the old days of, large classrooms, which were sort of lecture heavy and people waited for pearls to drop out of their attendings' mouths. It's really focused a lot on interactive learner-centered approaches. Today, we have the ability for, including our patients, to get information at the point of care using a complex machine, which when I trained used to be in air-conditioned rooms in one part of the hospital. Today, we have this technology in our hand, and our goal is to not only integrate this technology and continue to do so, but how do we continue to evolve in terms of learning? And that is sort of the focus of engineering. May I have the next slide, please? And so engineers, a big call out for my engineering colleagues who really have taken the lead in systems-based thinking. And our goal is with SOMI and with the clinical faculty really designing integrated curricula and using human factors engineering in enhancing the environment. Gone are the days where the medical students could not even ask a question for fear of being shamed. Today's learners really are engaged. They have questions. They're also able to answer a lot more questions. I love interacting with medical students because they ask the most unusual questions and we look them up together. The other important integration is in design thinking. As we take a problem, again, coming back to the patient that I talked about earlier, this particular patient was able to use an app to track his heart rate and rhythm. And we were able to come up with the diagnosis before he went to the cardiologist. And imagine when we are able to do this in a uniform approach for every single patient. That is really the goal of merging our engineering principles into medical education. Next slide, please. I'm not going to go into detail, but this is just a highlight. And again, huge thanks to my ASU colleagues for providing the slide. Really, our curricular design is based on having an MD and a master's in engineering. Anatomy and clinical skills will be integrated, and unlike the traditional cadaver-based anatomy, we will be using imaging, CT scan, radiology to really teach anatomy. But most importantly are the patient stories and really including artificial intelligence, the development of avatars, while maintaining authentic patient stories and patient experiences. And so we have our Associate Dean for Humanities who will be leading some of the curriculum to ensure that while the science of both medicine and the principles of engineering are maintained, we are authentic to our traditional medicine in the human-patient interaction. Next slide, please. And so I'm very happy to report that we have a wonderful dean, and you can see Dr. Lizenby, who is demonstrating one of her projects. She came to us from the NIH, and we underwent a site visit from the accrediting body in June and hope to hear positively from them in October. And shortly thereafter, we'll start rapidly the process of recruitment. We will have 36 students per year to start out with, and we hope to open our school next year in summer. Next slide, please. And so how do we do all of this? It takes a huge community and a huge village. We have our basic scientists, our engineering engineering faculty, and then we have all the doctors as well as our allied health partners as well to help train and develop the curricula for the medical school. HonorHealth will be the site for the rotations, for most of the rotations. Next slide, please. We do this by really having a vision. So this photograph on the left is the traditional model of teaching anatomy with the skull. On the right is a futuristic, but here we actually underwent, we sat with a company that provides educational technology using virtual reality. And so it's really about radically changing medical education right from medical school all the way through residency, fellowship, and continuing medical education. Folks like myself who've practiced for several decades now really have to be at the center of this change. Next slide. And we do this by really upskilling some of our own needs. And so I've been practicing medicine as an internal medicine doctor for a couple of decades now. And I can't tell you the warp speed. Again, sorry for the Star Trek references, but really technology has been changing. When I started, we used to have very small, little, almost pieces of paper, and we would write the notes. And then they became huge charts. Then came our electronic health record. And during this entire transformation, technology, whether it be surgery or whether it be neurosurgery or primary care, has really changed the way we practice medicine. And I cannot emphasize enough the important role that our educators play. Our physicians, our clinicians, the physicians at the bedside, our healthcare teams, our students really will learn from each and every aspect of interacting in the clinical learning environment. And so the areas that we want to continue to focus on is really that collaboration with facilitators, mentors, with developing clinical rotations, and how do we support our students in developing capstones, innovation ideas, ultimately with the hope also to develop their own apps, companies, and so on, while providing exceptional patient care. May I have the next slide, please? And a lot of just focusing on some of the technologies, the list is really large, but I want you to pay attention to the photographs on the screen. On the left is the original dissection atlas. It's a picture of the dissection atlas by one of the fathers of anatomy. And on the right, you see what virtual reality and how imaging looks like and how you can teach anatomy. And so it's really about the integration of teaching using advanced technology, but also using technology for continuous self-learning. using what we call ambient technology, where you can hear the interaction between a student and perhaps a patient or a simulation, and they get continuous feedback to improve. I already talked a little bit about virtual reality and wearable technologies, and part of our teams, both at SOMI as well as HonorHealth, we are applying for grants to really test these technologies within the lab as well as within medical education. Next slide, please. And so to summarize, really the call to action, in summary, medical education is really at a pivotal innovation point. We have the opportunity to really explore, expand, and innovate in medical education itself. All the time, we do want to continue to blend tradition. The best part of my time is my time with my patients and really making an impact on healthcare. We want to maintain that and using engineering and technology as tools. We definitely want to make sure that ultimately anything that we do keeps the most important part of the healthcare system, which is the patient, right at the center of care design. And the partnership with SOMI and HonorHealth will provide a sandbox for testing new models, both for education, healthcare delivery, keeping at the center the patient-physician relationship. May I have the next slide? And with that, I want to thank you for your time. I kept my presentation intentionally short so that we could have a dialogue and answer any questions. Thank you so much.
So thank you, Dr. Radhakrishnan. A quick basic question. Why is recruiting top professors and clinicians so important to this effort at this particular time in healthcare?
It is incredibly important because we want to bring in the experienced folks who have the experience of really building systems, research, technology, and bringing it to the level of the patient as well as the student. We want to assign time for our clinicians, and especially those who are experts in top fields. Our goal is to recruit chiefs within our different areas, whether it's cardiology or neurosurgery, medicine, and the different areas and specialties of medicine so that they can actually teach our students and also provide exceptional patient care. They will help build up the partnership between SOMI as well as ASU, all the while keeping, again, the needs of our community at the center.
Thank you. Another question for you is really around this notion of how does engineering really going to affect healthcare? We hear things like the opportunity could exist in the future or currently to 3D print body parts on demand with patients' own DNA to eliminate the risk of rejection and those type of, is this reality or is it really the future? And can the talent that is envisioned to be developed at ASU meet these new ways of providing patient care?
That's the beauty. So just yesterday, for background, one of the things that I work on from a research perspective is what is called health systems research. And, we had a wonderful conversation with some of the researchers in ASU to talk about how wearable technology can move from the lab space to the bedside. And really, this partnership will provide that platform, whether it is designing a new body part and addressing such as a valve to address some of the deficiencies of current systems, or developing new procedures, even drugs. We have several partnerships in discussion, which I'm not at liberty to talk about, but really the opportunities right from the bedside, how care is delivered, with partnering with nurses and the healthcare teams in remote monitoring, all the way to genomics, really tailoring medications for patients. And so it's really the length and the breadth of medicine. For most of us, myself included, I would think of engineering as sort of, a car or a machine. The human body is the best designed machine. And what an amazing opportunity to really work with the folks who are at the lab and partnering them with our clinicians to really improve patient care. That itself is probably a symposium that we should plan for.
Great. A couple other questions coming up on the chat here is really about, the clinical experiences. How do you see that affecting Honor Health and patient care in general? How many hours will physicians or aspiring physicians and aspiring nurses get at Honor Health? And then if we could go so far as to say they complete their academic education and now they're into fellowships and residencies. What does that kind of look like for Honor Health and patient care?
Yeah, and to start, thank you. That's a really great question. And so, our goal is that for so medical education, particularly the medical school process, can be divided into what is called pre-clerkship, which is basic sciences and some of the sort of, physiology, anatomy, and so on. And then the rest is clinical. Our goal is to integrate engineering as longitudinally, but the core clerkships will occur at Honor Health, with the exception of a couple, such as pediatrics, that we don't have. And then our goal is really to make sure that our students are able to interact with the larger healthcare team, the larger student population, residents and fellows. And ultimately, one of the reasons why we looked for a primary clinical affiliation, it was to make sure that we continue to build the pipeline of medical students through residents, through fellows, and then staying within our community. All the data shows that residents tend to stay where they train. And so having a pipeline with the culture of SOMI and Honor Health really will fulfill that.
Thank you. Another quick question has popped up. How is the School of Nursing involved with the School of Medicine partnership?
That's a great question. We are working. So we have in parallel Teresa Connolly, who leads our nursing education, is having conversations with with the ASU Edson School of Nursing. We've always had, again, the 1,000 other professional students per year is a large number are nurses. And we will continue to really work together to fulfill some of the nursing needs that were shown, particularly during COVID, which really showed us where our gaps are. And so we have groups that are working in parallel to the medical school.
Well, this has been really exciting to learn about all these things taking place. We have time for just a few more questions here, so let me pull one off the list. Let's see here. What is the timeline for fully implementing this clinical partnership?
So we signed our affiliation agreement last year in the fall. The school starts in 2026, around summer is our plan. And then we will graduate our first class in 2030. So we're really excited about this. All the work groups have been now working for almost a year in designing what to the level of the student. What does the clinical rotation in, say, internal medicine looks like? What are the goals of the curriculum, the objectives? What are the resources that we need? So this partnership will also need resources in terms of space, buildings. So we want to make sure that we have sandboxes, technology, and above all, educators and leaders who will really forge the innovative partnership.
So what is going to take place within the curriculum as you deploy all this new technology and training and teaching and educating and we bring engineers into the medical space? How does this kind of partnership keep the human at the center of care?
And so, one of my favorite parts of this curriculum, and I do not own this, this is being designed by an amazing faculty member, Dr. Fox, who's really brought together clinicians as well as folks that teach English and arts and bioethics and health policy in really figuring out like what does a humanities curriculum looks like. We had one of our work group meetings earlier on with pediatrics, and I'll tell you, so many years after my medical school, I still remember the first time that I had to perform a code on a patient. And those are just imprints in our brain that we cannot forget. Every time we lose a patient or we celebrate a success of a magical recovery of a patient who we thought were very sick, those are the experiences that keep us human. But those are also the experiences that lead to burnout if not addressed appropriately as we lose patients. And we saw this during COVID. And so well being is a really important part. And again, our goal is to keep space within the curriculum, but also have the resources to train our teams. Whether they are faculty advisors, the clinicians, supervisors, preceptors, to really continue the what used to be called soft curriculum, but now is integrated within the actual formal curriculum.
What excites you the most about this partnership and its potential impact on the care of patients?
I think ultimately it's about really developing a scalable model where we can integrate technology to provide exceptional patient care and while lowering the costs. And this is a really important part. We have to make technology work for us. At the same time, things are happening so quickly that we have such a unique opportunity. We are indeed at a pivotal point in medical education, and while there's a lot of innovation happening around us, I think it's a time for physicians and patients to own this innovation and incorporate it in medical education.
All right, so I wouldn't be complete. There's a lot of other questions. I don't know that we're going to get to them all, but I do want to get in a question regarding philanthropy. The margins in healthcare are generally 1 to 3%. What you're talking about here isn't necessarily chargeable to Medicare or Blue Cross Blue Shield or other insurance companies. So philanthropy really has a critical role here. What are the needs? How can philanthropy really benefit and advance this partnership?
It's through many different ways, whether it's consideration of, providing technology for at the bedside. And a small example might be point of care ultrasound, so not just the equipment, but it takes time to train physicians, like the educators, while providing the instruments and providing space. As you're well aware, Jared, it's only the clinical time where we see patients is billable. The rest of medical education as well as research really requires time, and philanthropy is an integral part of it. Right from sort of personnel, technology, all the way to space resources. I think, we are extraordinarily grateful to our community who have supported us so far and really hope that, we can continue this partnership.
Can you speak to some of the endowments that are necessary to make this partnership a reality?
So some of the things that we've been thinking about as we design our endowed chair, for example, whether it's in a particular area that a community member may be interested in, versus really programmatic endowments, which will help us for looking at how can we include technology, education, simulation within the framework of our academic affairs partnerships. The other is specific, service lines where we can continue to augment and enhance. And finally, specific programs, for those who have the love of humanities and arts, that's also an important part of our program and really providing, that is an opportunity to sort of integrate your love of art or humanities and writing into the medical curriculum so that we have really well-rounded, students who will become our doctors of the future.
So things like scholarships could be funded, endowed chairs, endowed fellowships, endowed residencies, endowed clinical experiences, all can be named for families or in honor of individuals. One unique thing about Honor Health is that 100% of the dollars that get donated will go to these programs. We don't take any fees off the top. And so that really allows the philanthropic community to do the most good and really help advance this partnership in a very meaningful and substantial way. Is there anything else that you would like to share or feel is important to share with those that are attending this Zoom?
I think, it's really the vision of, our CEOs, Todd Laporte and President Crow, who really made this happen, along with an extraordinary number of folks who actually were able to translate the vision into reality in 2026 as we opened the medical school. And it's long overdue. It's really an opportunity for us to change how we educate, but also how we care for our patients. I think ultimately, having this medical school will scale innovation and will also provide patients with the best care.
So I think that the hope is that by training this talent here, that it would stay here. Now, it's not all going to happen. We understand others will go to other places, but can you speak to that and the deficient supply that we currently have regarding healthcare professionals?
Absolutely. And, every year when we get our reports, Arizona actually does not fare really well. And partly, there are many reasons for this. Partly, our population continues to expand. And so, as I had mentioned earlier, residents tend to stay where they train. And so we started our planning journey with graduate medical education, and then very quickly realized that, we do need the pipeline of our students, and we want to keep students from Arizona, and we want them to stay in Arizona. And so really that longitudinal starting from ASU as undergraduate, and of course, all our other local schools. So we have deep partnerships with many of our universities. We will fill the pipeline into medical school, into residency and fellowship programs. And, we have a pretty strong record of retaining our residents and students, and we hope to continue to improve year after year. Actually, some of it, particularly in primary care, we've been, very fortunate in getting scholarships for these hard to fill areas such as primary care or hospice and palliative medicine, addiction medicine, all the way to, like highly super specialized areas such as cardiology or gastroenterology. And so it's really about keeping our residents here and building that pipeline. And then our office also supports continuing medical education because faculty are at the core, our attending physicians are at the core of innovation, and we want to make sure that they are kept up to date and upskilled as well.
Well, this has really been insightful and quite frankly, it's exciting. This is a chance of a lifetime, right? You don't get to start up a medical school, let alone an advanced engineering school coupled with it, with an organization like Honor Health that has innovation as one of its core values there. And so very exciting, grateful for all of your efforts and your leadership and those that you're partnering with to help make this possible. We've got a slide up on the screen for those that want to know how to take that first step to supporting this community initiative. They can contact Ashley Leahy. She's our Senior Vice President of Major Gifts. Her email address or the email address of the organization is there at foundation@honorhealth.com, as well as people can just pick up the phone and call us, schedule an appointment to talk with somebody to learn more at 480-587-5000. And of course, We have lots more information online at honorhealthfoundation.org. Dr. Radhakrishnan, thank you for your time. Thank you for your leadership. Thank you for transforming healthcare, because we know because of this partnership, cures will be found, lives will be saved, and the healthcare we know today will be entirely transformed. Thank you.
Thank you so much. And again, a huge shout out for the entire ecosystem of HonorHealth as well as ASU, who actually are making it happen. Appreciate everybody's time.